So you've been having pain in your shoulder, and it's a possibility that you're going to need surgery. Today, we're going to talk through all the things you need to know and questions you should ask before going through the procedure. So you've seen your doctor. Doctor's recommended surgery, and you've got a lot of questions. How much is it going to cost? What's my recovery time look like? Am I ever going to get back to normal?
Our pets' heads are falling off!
There's so many things to think about. And if you don't have all the answers, it can make this procedure really, really stressful. Hey, I'm Dr. Travis Owens. I'm a sports medicine doctor and a CrossFit coach, and I have found myself in a position where I actually need shoulder surgery.
And isn't it ironic?
This injury started almost 20 years ago when I was in college, where I tore part of my pec. For years now, I've actually done a really good job of being able to perform things like working on patients, competing, and coaching CrossFit. In fact, there's been stretches of time for over a year where I had zero issues with my shoulder. On the flip side though, there have been times when I was so sore in my arm, I could barely lift it for about a week.
Oh, I could barely lift my right arm because I did so many.
However, over the last few years, I've been able to maintain the health of my shoulder with using things like rotator cuff strengthening, range of motion exercises, stretches, and things that I would recommend for my patients. Recently, though, I've noticed that I've lost a lot more range of motion, and it's taken me way more time to get just to a baseline range where I feel comfortable when I work out. So, about a month ago, I got an updated MRI, and we found a torn labrum and a partial tear in my rotator cuff.
No! God, please, no! No!
So the injury that I have is what's called a slap tear.
What? Slap!
It's where my bicep tendon has actually pulled part of the labrum away from the socket. The procedure I'm having done is called a biceps tenodesis. The surgeon's going to remove the bicep from the labrum and attach it into the bone right next to where it originally attaches. By doing so, we take the torque off the labrum, which eliminates the pain and allows me to get back to full range of motion. The surgeon actually feels like once I get done, I should be able to go back to full activity, including all the things that I typically do and coach in CrossFit, as well as being able to treat my patients. Additionally, during the surgery, she's going to use what's called PRP, or platelet-rich plasma, to help make sure that the soft tissues in the shoulder are healing, as well as to help that small rotator cuff tear that I have. First things first, what's it going to cost?
$1 million.
So I have insurance that I'm going to be utilizing to cover as much as I can. With my current policy, my total out-of-pocket cost is going to be just over $700. Now, unfortunately, insurance considers PRP to be a cosmetic procedure. And so because of that, they typically don't cover that in a surgery. So for that, I have a separate fee, which is going to be $200. As of now, my surgery is a little over a month away. So because I'm going to be out of work for so long, I have to file for long-term disability. Now, with my particular company that I work for, short-term disability covers up to 12 weeks of time out of the office, and then anything beyond that goes into long-term disability. Additionally, I have to discuss with my boss about taking what's called a leave of absence, which again can vary from company to company. In order to make sure that I'm covered, I have to submit all of my paperwork to the disability insurance company to make sure that I'm approved for the procedure. The last thing you want to do is to get scheduled for your procedure without having your long-term or short-term disability in order, because if you're out of work and you don't have this coverage, then you won't be able to support yourself, and that creates a whole lot more stress. Make sure to discuss that with your HR before you do anything. If your work is a little less strenuous than mine, there's a really good chance you'll be able to return back to work a lot sooner. If I were to work at a desk or have a very minimally active job, there's a really good chance that I wouldn't need to file for such a long time frame out of work. I actually have a patient that just had this procedure done, and we were joking that he was back in work within a week. He's a teacher, and because of that, he doesn't have to use his arm as much, and so he was able to return to work without having to worry about long-term or short-term coverage. But if you work a physically demanding job of any sort, just make sure that you're covered before you actually move forward with the procedure. Typically, when you have a surgery, you're going to have 3 fees that you have to pay. One is going to be for your surgical team. The second will be for the location. In my case, will be at a hospital, sometimes done at a surgical center, but you'll have a location fee. And third, you'll have a fee for your anesthesiologist. Now, my surgeon also has a surgical team member that's a PA that will be working with her in my surgery. Some insurances don't deem this necessary and may not reimburse for her services. If that's the case, I'll be responsible for another $200 to cover her fees. Once the surgery is done, I'll also have PT that I have to do. Now, my PT is going to go for 3 months. That will either be covered by my insurance if I meet my max out of pocket for the year, but if I don't, and I'm only over my deductible, then I'll be responsible for an 80-20 copay, which means the insurance will cover 80% of my PT and I'll cover the other 20%. If a PT visits $100, I personally will be responsible for only 20 of that.
2 + 2 is 4, -1, that's 3, quick maths.
If I do meet my max out of pocket, all of my physical therapy after the surgery will be covered at no cost. The total recovery time for this procedure is anywhere between 4 to 6 months. Realistically, closer to the 6-month mark, but if I respond well to care and respond well to therapy, there's a chance that I'll be able to get back to at least working in the clinic and treating my patients at a sooner time frame. However, I'm not going to rush things because the only thing that is really pivotal with this surgery is that I don't tear the bicep tendon. That's the major part of the surgery, and so there's no way that we can let that fail. So I will be definitely listening to the suggestions of my surgeon and of my physical therapist. But they both know that my ultimate goal is to get back to treating my patients and to get back to doing full activity, both teaching and coaching CrossFit and doing CrossFit myself. Prior to the surgery, I'll have to get blood work done within 30 days of the surgical date. This is to ensure that things like blood sugar, my total blood cell count, and other things that are important to the healing process are in check. Major things we want to avoid are things like infections and a lessened ability to heal. On the other side, we want to make sure that I don't have risks for clots. This can happen with any procedure, so the biggest thing is to make sure from a blood work standpoint, everything is perfect. The surgeon's office has reached out to my primary care doctor to make sure that I get my blood work done in the window of time that she needs it to be done. One other thing that's important that I do before the surgery is to use a specific soap to ensure that I lower the amount of bacteria on my skin. The soap that she's recommended is called Hibiclens. It can be purchased at any pharmacy, and the purpose of it is to really deep clean my skin, and this soap in particular helps to prevent bacterial growth on the skin. So prior to the surgery date, I'll begin cleaning my shoulder with this particular soap to ensure that I lower the risk of infection after surgery. One of the biggest questions I get asked is if CrossFit is what caused my injury, and the answer is no.
Why the you lying? Why you always lying?
CrossFit was able to keep my shoulder strong and with a good range of motion for many, many years from the initial injury. I actually tore my pec while I was coaching a cheerleading camp when I was in college. After my injury, CrossFit's actually what kept my shoulder healthy and strong and kept the range of motion that I did have and increased my range of motion. My surgeon was very clear to tell me if I hadn't done CrossFit in the way that I have, which is safely and listening to it, that it's likely I would have needed this procedure many, many years ago. So for all the people that are wondering if CrossFit hurt my shoulder, no. In fact, CrossFit is what kept me able to continue to be active for almost 20 years after my initial injury. I'm going to be documenting this process all the way from the time I have the surgery through my first PT session, which is going to be about 3 days after the procedure, up until I get back to both working fully and coaching and competing in CrossFit. If you have questions or concerns about it, you gain a little insight into what the procedure is actually like. If you have questions about shoulder surgeries or anything to deal with this procedure, leave them in the comments below and I'll do my best to give you a clear and honest answer. There are definitely some things that I'm not 100% sure on, but I know who to ask and I can get an answer for you. Even though this is kind of a stressful point in life where I'm going to have everything kind of flipped upside down, I have full faith in my surgeon and I have full faith in my PT. I was very upfront that the goals I have are potentially different than most people, and she assured me that the therapist she's going to get me with after the surgery fully understands what I'm looking to do and what I'd like to gain out of the surgery, and that gave me a lot of peace of knowing that my likelihood of getting back to full activity is very, very high. As things unfold, we're going to document everything so that there is full transparency into what this is like. I know it's going to be stressful. I know there's definitely going to be some challenges, but it's something that I'm ready to get done so that I can move forward with my life with a healthy and pain-free shoulder.